This is Dr. Vinay Agrawal. I am a cornea and ocular surface specialist practicing in Santa Cruz West, Mumbai. Today we will try and talk about a problem which is affecting more and more of us with the changing lifestyle, increasing usage of computer screens, video units, mobile phones, condition which is labeled as dry eye. Essentially, this is a condition wherein the tear film in the eye is not able to do its normal job, leading to a condition of dryness, and therefore the patients usually would complain of either grittiness in the eye, foreign body sensation in the eye, a feeling of heaviness, pain, redness, or a fluctuating vision. All of this or any of these symptoms can be a problem and can be a cause of dry eye. Usually precipitating factors could be, as I already mentioned, the whole lifestyle issues. In addition, certain diseases like arthritis, collagen vascular diseases can cause swelling or ocular surface inflammation and therefore a reduction in the amount of tear film that is produced in the eye. Both of these disease conditions, though presenting similarly, would require a very different approach in terms of management. So how do we diagnose or how do we understand that there is a problem? With the presence of all the history that I have mentioned previously, there are certain tests which an eye surgeon can perform in the clinic that will help the diagnosis and for the person to understand as to what kind of dry eye or what type of disease presentation is there in his given case. And according to that, in her or his case, the concerned doctor can decide the kind of management that is required. Essentially, we would break down the treatment into a variety of things, which is, for example, taking care of the meibomian glands or the lid glands which are present, which will take care of the outer tear film layer, or if there is a genuine loss of tear film, we can replace it with the help of artificial substitutes like the tear substitutes that we have. A variety of options and a variety of drugs are now available. In a given case, the suitability would be decided by the treating doctor. In addition, the newer understandings of dry eye have told us that inflammation or swelling inside the surface of the eye can be an important precipitating factor. Therefore, ocular surface inflammation management is becoming a more and more important tool in managing patients with dry eye. A variety of drug options are available, right from corticosteroids to non-steroidal anti-inflammatories. Each one of them has a role to be played depending on the severity of the disease and a given patient. So instead of doing any self-medication, it would be advisable that you approach a qualified eye doctor who would be best placed to decide as to what would be the best treatment option as far as you are concerned. In addition to putting drops in the eyes and doing hot fomentation for the lid diseases, there are other options which are existing for patients who have a more severe version. For example, there can be plugs which can be inserted in the area which helps in drainage of this tear film, thereby helping to retain the tear film for longer periods in the eye and therefore helping a patient who has a reduction in the production to be more asymptomatic because more tear film is retained for a longer period in the eye. In addition, there have been a variety of other products that have been tried. For example, ocular inserts have been attempted, though with limited success. And there are a variety of treatment options which are now existent, like for example, the intense pulse light therapy, photobiomodulation, both of which work more on the lipids or the lipid glands of the ocular surface, or to be more precise, the glands which are present in the lid margins. Each one of these treatments is useful, but we should understand that none of these treatments replaces others. All of these treatments are complementary, and therefore taking an expert's advice would be the right way to do and understand as to what combination of therapy would be in your best interest. Thank you for your attention today, and I hope we've cleared some of your doubts about dry eyes. If there are any further questions or if you have any doubts, please feel free to contact me either on librate.com or corneatransplant.net, and I would be more than happy to answer any queries that may arise. Thank you once again.